Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 10th video of repeat revision course of Periodontics, which is very important for NLE, NBD, MDS as well as for BDS students. In this video we will discuss about plaque disclosing agents. In coming videos we will discuss about mechanical and chemical plaque control. But in this video we will discuss about plaque disclosing agents. Now, what are plaque disclosing agents? These are the agents which we apply on the teeth and they stain the plaque, and then these stained plaque we show to the patient and motivate the patient to remove the plaque from the teeth to maintain oral hygiene. Now, what are the uses of plaque disclosing agent? There are three uses. Number one, to calculate plaque index. Second, it is a visual aid for patient to motivate them to improve oral hygiene. Third, to monitor effectiveness of plaque control. Like between visits, we apply and check how much plaque control we achieved, how much the effectiveness of plaque control per monitoring of plaque control effectiveness. These are the uses. Now come to the before detail, come to the last question. What are the requirements of an ideal plaque disclosing agents? There are four requirements. Number one, a test should be acceptable. Second, has a color then can be easily distinguished from adjacent tissues like gingiva. Third, does not wash off immediately. And fourth, should not cause irritation to the mucosa. These are the requirements of ideal disclosing agent. Now come to the disclosing agents and its detail. First is the iodine. Iodine, when we apply iodine on the teeth, it stain the plaque brown or black, but it is unacceptable. Why? Due to its unacceptable taste and cause allergic reaction. Second is the erythrocin. This is the most widely used in clinic, and it stains plaque and gingiva pink. Next is the two-tone solution. The two-tone solution is the when we apply on the teeth, if the plaque is mature, its color will be its stain will be blue. If new plaque, its stain will be red and does not stain gingiva. Fourth is the fluorescent dye. Fluorescent dye is actually a fluorescent based solution, invisible under normal light, require special light. When we apply on the teeth, it stains the plaque greenish yellow, and it does not stain gingiva restoration. Dye is not visible in normal light, it requires special light. Has good contrast compared to the gingiva, mean its color is different from gingiva, we can easily differentiate. Now choose this one, mean fluorescent dye, if you want to use a computer system for plaque quantification or for research. Mean for research and computer system, if we use, then we use fluorescent dye, but in clinic we use erythrocin. Next is the tri-plaque ID gel. Look at the diagram. When we apply tri-plaque ID gel, if there is a new plaque, its stain will be red. New plaque, its stain will be, it stain the new plaque red. If there is an old plaque, it stain the old plaque purple. If there is a extra high risk plaque, there is a more bacteria in this plaque and they produce acid. Acid producing plaque, they stain blue. This is all about plaque disclosing agent which we use to apply on the teeth. If a patient have plaque, to motivate the patient because they stain the plaque, and to motivate the patient to remove this plaque and keep good oral hygiene. Now these plaque disclosing agent uses, requirements, and disclosing agent name and its use are very important for MCQ's point of view. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you're new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.